Tenotomy, open, flexor or extensor tendon, forearm, and / or wrist single, each tendon. An incision is made in the wrist or forearm over the site where the tendon to be cut may be accessed. The subcutaneous tissues and fascia are dissected to reach the target tendon. The usual method is to cut into the tendon so as to allow it to expand and heal as a longer tendon, thereby releasing a contracture caused by the tendon. The tissue layers and skin are closed and a dressing is applied. Tenotomy, flexor, palm, open, each tendon. Tenotomy, flexor, finger, open, each tendon. The physician incises a flexor tendon. The physician incises the overlying skin and dissects to the flexor tendon. Tenotomy, extensor, hand or finger, open, each tendon. The physician incises an extensor tendon in a hand or finger. The physician incises the overlying skin and dissects to the extensor tendon. The tendon is incised. The incision is sutured in layers. Report each tendon separately. Tenotomy, open, hamstring, knee to hip, single tendon. Multiple tendons, one leg. Multiple tendons, bilateral. The patient is positioned prone. The physician makes a longitudinal incision beginning just above the popliteal crease and extending upward. Dissection exposes the hamstring tendons. The tendon sheath is divided and the tendon is incised transversely at 2 levels, 3 cm apart. The physician flexes the hip while the knee remains extended, causing the tendon to lengthen. The tendon sheath is closed. The incision is repaired in layers. Tenotomy, open, tendon flexor, foot, single or multiple tendon, S. Toe, single tendon. A small incision is made on the back of the ankle and a sharp blade knife is inserted into the Achilles tendon and rotated medially and laterally. The foot is forced into dorsiflexion to stretch the tendon to the appropriate length. Direct pressure is applied to control bleeding. A suture is made in the incision and a dressing is applied. Tenotomy, open, extensor, foot or toe, each tendon. A small incision is made on the crease of the toe on the bottom of the foot. The skin is reflected and the tendon is exposed. The tendon is released from its attachment site, allowing the toe to extend. This usually is accompanied by other procedures. The incision is closed with sutures and a soft dressing is applied. Tenotomy lengthening, or release, abductor hall UCI's muscle. A dorsal incision is made over the first metatarsal bone extending to the middle of the big toe. The skin is reflected to expose the underlying soft tissues. The abductor hall UCI's muscle is identified and its distal insertion is removed from the bone of the big toe. This allows the toe to move back out into proper alignment. The incision is closed with sutures and a soft dressing is applied.